Welcome back. You're with the Providence Holy Cross Health Hour on KHTS, AM 1220, your hometown station. And we're joined today, luckily, by one of our neurosurgical super studs here at Providence Holy Cross, and soon to be in Santa Clarita as well, Dr. Nanjiani. And thank you again for joining us today.
Glad to be here.
And, just before the break, we were just kind of talking about the fact that it's probably some of the nicest comments that I had the chance and opportunity to be able to read was not only just in the surgical care, diagnostic care, and your ability to explain things, but it was more so is that you actually cared. The way that you approach patient care was very personable, as we mentioned off air, was that these are in essence, like family to us. And do you want to talk a little bit about that?
Sure. For me, I think when you're talking to a patient, one thing I always ask myself is that if it was my family member, would I be saying the exact same thing? And if you can say that to yourself, you feel confident in your decision, you're doing right by the patient. And I'd mentioned earlier that, my mom actually had breast cancer, and it gives you a different perspective. It gives you the perspective of the patient. And you realize how difficult it can be for the family and how important it is to be available, to be receptive. That's why when I see my patients, I offer all of them my cell phone numbers. Because if they have any questions, they can reach me anytime. And I think that is important. And this isn't just a job. I think that's one distinction that I have. There's a higher obligation here, higher responsibility. And that to me is very important. And sorry, go ahead.
It's a calling. It seems to be. It's not just you're not punching a clock. It's just something that you make. You made a decision a long time ago, and we're going to ask you about that. But you made a decision a long time ago that you were going to base your career on caring for others. But what drove you? What was your deciding? A lot of the times. I teach at CSUN part-time, and one of the things that they say is, I'm not sure what I want to do. I'm not sure what direction to go. What drove you first into medicine, and then more importantly is, what directed you to go into neurosurgery?
I was always interested in the sciences. In fact, I initially liked infectious diseases more. I was interested in doing research on the Ebola virus and AIDS, and I wanted to go to Africa, and because my passion was research as well. While I was in college, I also got a chance to shadow a few clinicians, a few doctors, including a surgeon, and I think that sort of cemented my desire to go into medicine, because a huge part of medicine is research, because it's always evolving and changing, and you have to stay abreast with all the changes in cutting technology. So you can definitely contribute and advance, not just care for the patients, which is probably the most important thing. When I was in medical school, I realized that I gravitated towards surgical specialties that require a lot of finesse, a lot of skill. I acknowledge I have OCD, and I think it is beneficial, at least in my field. So I think neurosurgery, definitely has a lot of complex, cases that require a lot of finesse, a lot of meticulous dissection, and that just gravitated towards a skill set that I liked. And also, it is exciting. You're dealing with the brain, the spine. It's very complex, and to be able to try to understand and advance it is very exciting for sure.
That is fantastic, and it's the finesse side for certain. Goes back, oh my gosh, years ago, going through our cadaver labs and such. I'm a physical therapist by training, and I was only allowed to cap skulls, because anything gross, big cuts, I was allowed. Anything that required any finesse, somebody else would actually have to do. And probably, if you take a look at these two fingers, it's probably exactly the reason why finesse doesn't exist in my vocabulary. So very, very funny. The schooling, that is actually the case. You have a tendency of going one direction, looking at that direction, then for some reason something tangentially happens, and like you said, following the surgeon. Do you have any advice as far as for any of the high schoolers or the college age kids who might actually be listening today, or maybe pick up the podcast later to take a listen? How should they approach keeping their options open?
medicine, of course, is a serious commitment. It's a lot of time, but don't ever get discouraged by somebody else. I think it's hard work. I think what I don't like is when people say, "Oh, so and so doesn't have the hands to be a surgeon." I think that's not right. Really, the number one thing, at least from my experience, it's the hard work, focus, and dedication. It's practice. That's the key thing. There's no substitute for that. A good surgeon is somebody who's seen more and done a lot of cases, because really experience is the key thing. The most important thing is remaining focused and dedicated. So don't let anybody discourage you. Don't let anybody tell you that, your scores are not. You can always do things and focus and study and build your CV and other things to get to that goal. So just stay, I guess, dedicated is the most important thing.
Yeah, and that is it. It is it. You just kind of drive forward, and the good things happen for the people who actually try to open their own doors and the such. One of the things that you had mentioned just a second ago was the number of cases, and I think that's actually I had a wonderful conversation with somebody yesterday, in that when you are looking for a surgeon, okay, let's just say, the concept is do you look for that surgeon, or do you look for that facility that is continuously doing these types of procedures versus the ones who just offer those types of procedures? Can you expound a little bit on that? It's just on how important it is, not only that the person can do it, but they continuously do it to try to keep their skills sharp.
Absolutely. I think that there are two components to it. One is, of course, being at a facility where they do the procedure very frequently. The other component is, when you're trying to get an opinion, it's always good to talk to different people, because somebody might do the surgery just one way, and there might be a newer technology, a newer approach. So it's good to get a consensus and an idea. But of course, practice makes perfect. For example, when I was in med school, we had a cadaver lab as well. Every Friday, Saturday, I would go there religiously to practice, and it was available. Because some of the other colleagues did not take advantage of that. And that's the distinction. Even if you are, practicing anastomosis, attaching vessels together, it's that dexterity, it's that skill that you're developing, the ability to navigate under the scope. So all those elements add up, and it's, like I said, it's really the hard work and the dedication, and there's no substitute for that. So and that's something that anybody can apply.
Right. So just practice, and working with the people, or seeking out the people who actually do this regularly. And that's, I think, one of the pieces that we find over at Holy Cross. In my role with the orthopedic department is also overseeing the total joints, and a generalist who might do total joints might do maybe 1 or 2 or 3 a month, where else a lot of the surgeons at our hospital, they're doing 2, 3, 4, 5, 6 a week, and it's very noticeable in the outcome, where it's really noticeable on when patients are able to go home, and on their pain control and such like that. And so that expertise and that trying to maintain that is going to be hugely important. And technique and expertise, I think, leads into the next piece. And for those who have listened to the show or picked up on the podcast, we had one of your colleagues, Dr. Avila, on, and we're lucky enough at Holy Cross. I mean, it's not often that within a region you have one person who is capable of being an expert in skull-based surgery. But Holy Cross, we have 2. Including, and yourself included in this, and that is absolutely tremendous. And tell me, why is that such an expertise?
Sure. So skull-based lesions are challenging because at the base of the skull. So to get to these lesions, you have to develop narrow corridors where you can operate from, and you have to create these corridors because you can't simply lift the brain up. So you have to create small windows where you can access the lesion. Not just that, but most of your critical nerves, cranial nerves, and vessels are in that region. So if you were to compromise a vessel in that area, you can cause a major stroke. So you have to be very careful as you navigate around the cranial nerves and the vessels. In fact, that was one of my motivations to actually do skull-based surgery at Johns Hopkins, because if you can do that, if you're comfortable to navigate around these vessels and nerves, and you can do skull-based surgery, that makes you overall a great cranial surgeon. Right. Because then you know how to handle the situations. You know how to address if there's bleeding from a vessel. You know how to be careful with the nerves, how to resect a tumor and develop a plane around it without compromising those key features. So that was the reason why I did the skull-based fellowship. And of course, my interest is in neurosurgical oncology. And in addition to that, I did that complex spine in-folded specialization, because if you can do complex spine, which is deformity or spinal tumors, then you can certainly deal with degenerative spine and other pathology as well. So in addition to coinciding with my interests, which was the reason why I did the fellowships, but also it gives you added confidence and experience in dealing with even challenging pathology. But the skull-based, of course, definitely is one of the more challenging aspects of neurosurgery.
Right, and it's amazing that we have the ability to offer it over at Holy Cross, and with our affiliation with City of Hope, my assumption is that we will be doing a number of these types of procedures on a regular basis. And then you mentioned on the spine too. Gosh, what is it? 80% of the working population is going to require time off from work due to a back injury, is what came from the labor statistics, I think, not so long ago. And I think, aside from cancer, low back is also the highest cost medically around as well. So when we're looking at spinal injuries, we do have our degenerative changes, our usual wear and tear that have been so kind to build up on most of us over time. But on the traumatic side, that's something that you shared with me about a week or so ago with one specific case, which was absolutely astounding. And I did get an opportunity to see the X-ray, and the work was pristine. One, congratulations, that was fantastic. But two is just the explanation that you had to be able to do fixation in a specific way because of the pathologies that you came across.
Right. It was unfortunate gentleman who had a high cervical injury and injured his spinal cord, and unfortunately was paralyzed as a result of that. And it was essentially equivalent to a hangman's fracture. So if somebody were to be hanged, that's the type of fracture they would sustain. And essentially the spine had translocated anteriorly significantly, and in the process injured the spinal cord. So the surgery involved putting in the instrumentation and bringing the entire alignment, bringing the spine back to correct the fracture itself. But the other challenging part of that case was, as a result of the fracture, this patient had compromised blood flow in one of the vessels, the vertebral artery, on one of the sides, on the left side. And the risk of fusing the spine in this case was that the instrumentation that you place, the screws, are in close proximity to the vertebral artery on the other side, and that's one of the risks of the surgery. So if the other vertebral artery was compromised in the process of instrumenting and stabilizing the spine, you would lose blood supply to a critical part of the brain, and that can result in a stroke. So in that sense, it was extremely important, pivotal, not to compromise the vertebral artery on the contralateral side. And this is where the navigation becomes very important, using the navigation to instrument the spine so you can actually see in real time where the screws are going, so you can preserve the neural elements, the spinal cord, the nerves, but also the critical vessels, and correct the alignment and stabilize the fracture. And of course, being at Providence, it's a significant trauma center, so we do see such complex pathology as well. And interesting, you mentioned back pain. That's probably one of the most common complaints that we do see. And the way I describe it is, just like you have arthritis in your joints, you also have arthritis in your spine, and that arthritis eventually leads to narrowing of the the foramen and the canal where the nerves exit, and that can cause symptoms. But some of those symptoms can resolve with conservative management, with physical therapy, pain medications, and of course, when we see patients, we want to make sure that they have tried the conservative measures first before considering surgery.
Right.
And if only those measures have failed or the pathology is significant, then we would consider surgery. And like I said earlier, if the patient sitting across from me, if he's my dad, my brother, my sister, what would I say? And that's the same advice I would give them. So
right, and I think and it reminds me of a person I was asked to take a look at privately, and they had full blown nerve roots weakness, lack of sensation and the such, and was only progressively getting worse just in talking with the person, and so we were referred over and they ended up doing surgery. One of the things that is becoming more impressive is not only are we able to do minimally, if you can call it minimally invasive for the brain, but we can do minimally invasive for the spine as well. And there are much smaller, now granted, I've been doing this for like 27 years. Someone would go in to have a fusion and they would have a 6-inch incision along the backside of their back, and a significant amount of tissue trauma post-surgically. They're going to be in the hospital for a good 6, 7, 8 days, with the first 3 in horrible pain with a lot of spasms and such because of the trauma. Now you're able to do minimally invasive type procedures, and in some cases same day, right?
Absolutely. And that's just been the trend overall in all surgical specialties. But yes, patients who have a herniated disc, you can, do the surgeries with a small tube system. So make an incision that's less than an inch and insert a tube. And once again, similar to the principle in the brain where you are moving the fibers away, you're kind of going through muscle without actually transecting the muscle. And so you dock directly over the specific level. You're able to remove the disc, and then you pull the tube out, and then essentially close the less than an inch skin incision, and the patients do go home the same day. So yes, we can do, even fusions now can be done in minimally invasive, and that's where we're heading, because it is important for the patients to recover faster and get back to work, and that's what we want as well. And so that's overall the trend in neurosurgery, in spine and for cranial cases. One of the interesting things we talked about is a case with the brain PAT system. Now, in addition to defining key areas in the brain that are involved for speech and motor, we can also visualize the actual fiber tracts in the brain. We can actually visualize the corticospinal tract, the tract that controls movement, and the fibers that are communicating from one part of the brain to the other. And it's called DTI sequencing. It's a special MRI sequencing. And so we can identify not only the key areas in the brain, but these fiber tracts that are communicating, and find small corridors where we can insert these tubes to remove lesions. So really, patients can come out with minimal deficit with these surgeries and have better function and outcome. And that's really the goal for all surgeries, not just in neurosurgery, but other specialties too.
That's fantastic. And we had Dr. Pernay on a couple months ago, just kind of talking about just diagnostic imaging, things that were up and coming, and radiologic interventional radiology. The piece that he had mentioned, that we have a kind of higher level diagnostic equipment here in Santa Clarita. Actually, I think it's going to be in the building where you're at, with the PET scan or the CT PET scan that might be available, and I kind of foresee that this is going to be something that is going to be used quite frequently as they are deciding if they're going to be getting patients to you.
Absolutely. And like I said, all this technology is really designed to make the surgery safer and the patients have better outcomes and faster recoveries. And it's this commitment to not just providing excellent care, but up-to-date the best care with excellent clinicians. The colleagues who I've worked with, I'm tremendously impressed with them as well. That's the key thing that inspired me to come here and work with Providence Holy Cross, and I've no regrets about my decision. I'm so excited to be here, and I think it's been a great experience overall. So,
well, and the Valley is glad to be able to keep you here too, as you grew up San Fernando Valley adjacent. So so we're pretty excited that you get to hang out with us over at Holy Cross, and that we were your choice, which excites us tremendously. And here being today, like with KHTS has also been such a proud supporter for Holy Cross in all of our endeavors, and actually being part of our board and helping with decisions on how everything's going to be directive. That even KHTS recognizes the importance of Providence Medical Institute and bringing all of the experts for all of the different institutes that are operating within Holy Cross to try to assure that we're bringing the best to deliver the best for the community at large, which, being from the Valley myself and living in Santa Clarita, I will also say is the best. So that just makes us even happier. We're going to come back very shortly. We're going to have just kind of wrap things up while we're here on KHTS AM 1220, your hometown station. Don't forget to get that app, okay? So that way you can listen when you leave the Valley area, and anywhere you decide that you're going to go, whether in the United States or worldwide, you won't have to miss this show. See you soon. All right, so you're back here with KHTS AM 1220, hometown station, with the Providence Holy Cross Health Hour, and we're with Dr. Nanjiani, and we challenged, Justin and I, threw this out there. What is the freakiest, coolest thing that you've seen during your time here?
I guess here I probably would say unfortunately the spine fracture, I think, was quite traumatic. But in my training, I actually, I've seen a lot of severe trauma, including another gunshot to the head. But in this case, the person came in completely fine talking, and you could actually see the brain pulsating through the hole, the entry point for the bullet. But of course, in those cases, the concerning is the patients might be okay right away, but there might be trauma and bleeding in the brain. Of course, the head CT showed that he did have a hemorrhage that was expanding, so we did take him to the OR emergently, and for evacuation of the hematoma. He actually did fine. He survived and did very well and came back, did not have any weakness, anything. So he was very fortunate in that case. So
it's absolutely amazing. You mentioned gunshot, and I can remember where physical therapy used to be located over at Holy Cross. We used to be right next to the ER, and one of the trauma docs just kind of waved me over to come to discuss one of the cases that were in there, and he said, "What do you think their injury was?" And he said, "I'll tell you, it was a gunshot." And he was completely diaphoretic down the middle of his face and reading the New York Times on the other side. And I said, "We got shot in the stellate ganglion." He says, "Really? Why would you say that?" And it's like, because he's in shock on one side and not on the other side. And that's exactly what ended up happening. It was one of the coolest things I think if that can be cool, but it was one of the coolest things that I probably had ever seen. Well, there's another one too with trauma, but I won't talk about that one. In general, so we've seen endoscopic approaches going into the brain, skull-based surgery, the minimally invasive going into the spine, excellent diagnostician, amazing caregiver, and I'm fairly certain there are going to be people who will be listening to the show or listening to the podcast, or maybe even picking us up, because you can get us on Facebook too. They're going to want you to help care for them. So how do they find you?
Of course, I'd be happy to be involved in their care. You can, of course, reach my office for any appointments. The office number is 818-361-0917. Once again, that's 818-361-0917. And my last name is Dr. Nanjiani, but you can call me Jazz. No formalities. And like I said, if any questions, once I see you, can always call me too, and I'm happy to give my cell phone number to my patients as well. And the address for the office, it's 11550 Indian Hills Road, Suite 381 Mission Hills, California. So, like I said, if you have any questions, you can always call the office. I'm happy to answer those questions and also, be a part of the care. So, we're just excited to be here to serve the community and looking forward to being in Santa Clarita as well as Holy Cross. So,
We're excited to have you, and it's been a blast having you just for the short few months, and having had the opportunity to meet you before, and even some of the cases that you've had the opportunity to discuss. It was absolutely wonderful. You will be able to see Dr. Nangiana. He is locally right next door to the hospital on Indian Hills Road. If you don't have the number, can't remember the 818-361-0917 number, you can always get a hold of Dr. Nangiana through the hospital through 888-HEALING, HEALING. And for those of you who don't have the letters on your numbers, it's 888-432-5464. You're with us here with the Providence Holy Cross Health Hour, here every third Wednesday from 12 to 1. Thanks to KHTS, as always, for their support of our program. Special thanks to Dr. Nangiana for taking time out of his busy schedule to swing up to Santa Clarita to join us. And we look forward to having everybody. Dr. Nangiana, you want to...
No, I say glad to be here, and thank you for having me. So.
Oh, absolute pleasure. And we look forward to being back during December, and that one actually might be Justin and I. We'll see. Looking at some sports injuries and the such like that, common things that we might find in Santa Clarita as well as through California and in the sporting world. So again, thank you very much for your time, and we look forward to seeing you next December.